Hello everyone, welcome back. My name is Dr. Vijay Bhatia. Today I'm going to talk about autism. It's mainly to diagnose and what are the criteria and symptoms for diagnosis of autism. What is autism? Autism is a pervasive developmental disorder characterized by qualitative abnormalities in reciprocal social interactions and in patterns of communication, and a restricted, stereotyped, repetitive repertoire of interests and activities. These qualitative abnormalities are pervasive. That means they are present all the time, most of the time, in the person's individual functioning in all situations. In addition to these specific diagnostic features, a range of other non-specific problems are common, such as phobias, sleeping and eating disturbances, temper tantrums, and self-directed aggression. First, we are going to talk about childhood autism, and there's ICD-10 criteria. Childhood autism is defined as abnormal or impaired development and is evident before the age of 3 years in at least one of the following areas. Number 1, receptive or expressive language as used in social communication. So there is either some kind of abnormality or impairment during the development before the age 3 in their receptive or expressive language as used in social communication. There is impairment in the development of selective social attachments or reciprocal social interaction. So there is an impairment in this area. There is impairment in the functional or symbolic play. These all symptoms happen before the age of 3, and we will go through these in more detail. And at least one area must be severe enough to cause some kind of distress either to the person or to anybody else, and it is affecting their life, either social life or family life or even their education or the skills. The criteria B, there should be a minimum of at least 6 symptoms, and we have divided them into first, second and third, with at least 2 symptoms present from the first and at least 1 each from the second and third. We will go through one by one. Now, number 1, qualitative abnormalities in reciprocal social interaction are manifest in at least 2 of the following. Number 1, failure adequately to use eye-to-eye gaze, facial expression, body posture and gesture to regulate social interaction. So when they are having a social interaction, they have difficulty in maintaining eye contact or express their facial feelings in a way that they express, yes, it is, I like the conversation, I like your presence, and you express the facial expression, either smiles or gestures, and even your body posture. There is some kind of problem there when you are interacting with another person, that the other person doesn't feel welcome as if there is something lacking. Symptom B. Failure to develop in a manner appropriate to mental age and despite ample opportunities. Peer relationships that involve a mutual sharing of interests, activities, and emotions. So it's important to understand here that the person is having difficulty in building up peer relationships that involve mutual interests, mutual hobbies or activities and emotions. The person is having difficulty, and make sure that these are measured appropriate to that age, and also that the person has been given ample opportunities to develop these kind of relationships. The examples are that if somebody was brought up in an orphanage where there was no social interaction and there was lack of food and basic needs, and the person did not know how to interact and they were hungry most of the time, like children in Romania orphanages, they were difficult to develop normal relationship. So if the person is given enough opportunity and they do not suffer from any kind of mental retardation, and they are given the normal bringing up, but despite that they are having difficulty in making peer friendships of similar age with similar interest and activities, like playing sports and enjoying and laughing and making friendships. Number 3, or C, lack of social emotional reciprocity. So this is interaction when one person is trying to emotionally interact with you. You respond in a very appropriate way, as shown by an impaired or deviant response. So what happens if somebody is suffering with autism? Their response is either impaired or deviant to the normal interaction, emotional interaction, to other people's emotions. They have difficulty in understanding the emotions of other person, or what they're trying to say, or what they're trying to, they don't understand why this person is laughing, why this person is happy, or why this person is angry. They have difficulty in understanding the emotions of the other person. Or lack of modulation of behavior according to social context, or a weak integration of social, emotional, and communicative behavior. So they lack modulation of behavior in the context, social context, where they should be integrating in the environment with other people, both emotionally and in a communicative way. They seems to be at distant, at lack of that. Symptom D, lack of spontaneous seeking to share enjoyment, interest, or achievements with other people. Example, a lack of showing, bringing, or pointing out to other people objects of interest to the individual. So if this person is interested in some kind of hobby, either stamp collecting or other, they have difficulty going and showing other people, discussing their hobby or their relationship. So they are not fully aware. So, and they spontaneously will not do, even the other person asks, they might say something, however they would not act spontaneously to share their enjoyment and interest or even their achievements with the peer group or other people. Now, the second category of the symptoms, we need only one. Qualitative abnormalities in communication. This is about communication. The first one was mainly to do with the social interaction. So this is mainly with the communication, and at least one of the following must be present. A delay in a total lack of development of spoken language, that is not accompanied by an attempt to compensate through the use of gesture or mime as an alternative mode of communication, often preceded by lack of communicative babbling. Remember, autism starts before the age of 3, and because it's a pervasive developmental disorder, that means the symptoms are present in all situations, and they affect the growing up, the development of the person. So from early age, there is a delay or there is a total lack of spoken language that is not accompanied by an attempt to compensate through the use of gesture or mime as an alternative mode of communication. And this is often preceded by lack of communicated babbling. B. Relative failure to initiate or sustain conversational interchange at whatever level of language skill are present, in which there is reciprocal responsiveness to the communications of the other person. So if the other person is trying to have some discussion or talk in a friendly way, the person with autism have difficulty in understanding those and responding appropriately or accordingly. Stereotyped and repetitive use of language, despite, in fact, they tend to use similar words or similar phrases and answer the same things to different questions. Lack of varied, spontaneous make-believe or social imitative play. So when they are playing, there is lack of spontaneous variety of things they will play with. Rather, they will choose only one or two things and just get absorbed into that, rather than having a variety of enjoyments or play with others or even with their toys. Number 3. This is restricted, repetitive, and stereotyped patterns of behavior. So this is behavior. The first was social interaction. Number 2 was communication. Now we are talking about the behaviors. Now behavior in this case, autism, it is restricted, it is repetitive, and it is stereotyped. That means the moment you see this person behaving in that way, you know that it is him, it is her, because you know that this person always behaves in a similar way. So that is the stereotyped pattern of behavior where you can identify that person and they do repeatedly the same thing. And that is with the behavior and their interests and even other activities. And these are manifested by at least one of these following examples. An encompassing preoccupation with one or more stereotyped and restricted patterns of interest that are abnormal in content of or focus, or one or more interests that are abnormal in their intensity and circumscribed nature, though not in their content or focus. So they get absorbed in either one activity, and if it is more than one activity, they are abnormal in their intensity. It is too much. They don't have any boundaries left there. They get too much absorbed into that. Apparently compulsive adherence to specific, so they can have compulsive behaviors to do certain things, and non-functional routines or rituals. They might get involved in some kind of rituals, either counting or taking the bead and counting or touching or folding their hand or touching their body organ or something. So there is some kind of compulsive reaction behavior. Stereotyped and repetitive motor mannerisms that involve either hand or finger flapping or twisting. So they will keep on either flapping their hand or they will keep on twisting their hand, or even sometimes complex whole body movement. They will show this repetitive, stereotyped, that this is this person and this is the way they behave, and they are repetitive, happening again and again. Preoccupation with part objects or non-functional elements of play materials, such as their odor, the feel of their surface, or the noise or vibration that they generate. So they get very much absorbed by part of the toy. So if they have a toy, they might just like the way it smells or the way it feels, their surface, rather as a whole thing, or the noise they make, and they love that. But it is again a solitary interest. The clinical picture is not attributable to other varieties of pervasive developmental disorders. So when we talked about autism, number one, it is before the 3 years of age, social interaction, communication, and behavior. We looked at these ones, and they've been present before the age of 3, and it is a developmental disorder, and it's a pervasive disorder, and we should rule out other causes of such behavior or similar behavior at that age, and this can persist in throughout life, sometimes for long periods of time, affecting their development. So what do we have to rule out? Number one, specific developmental disorder of receptive language. So if somebody is already as a child is having problem with hearing, understanding, and therefore they have problem with their receptive language, they does not get the clear message, clear understanding of what other people are saying, either because of deafness or because of whatever other reasons, then they may develop some kind of secondary socio-emotional problems. So this must be ruled out in order to diagnose autism. If you are suspecting autism, try to rule out this one. The other one is the reactive attachment disorder. The third one is disinhibited attachment disorder. Number 4, if somebody is suffering from mental retardation and with some associated emotional or behavioral disorder, and sometimes unusually early onset schizophrenia might be getting confused, and Rett syndrome. We will discuss these in more detail because they are important to rule out in the diagnosis of autism, especially in the child, and when the child is growing older in adolescent, these must have been ruled out in order to diagnose properly because they are pervasive developmental disorders. The first one we said was the receptive language disorder, in which the child's understanding of language is below the appropriate level for its mental age. In virtually all cases, expressive language will also be markedly affected, and abnormalities in word sound production are common. So this must be ruled out. Number 2, reactive attachment disorder starts in the first 5 years of life and is characterized by persistent abnormalities in the child's pattern of social relationships, which are associated with emotional disturbance and are reactive to changes in environmental circumstances. For example, fearfulness and hypervigilance, poor social interaction with peers, aggression towards self and others, misery, and growth failure in some cases. The syndrome probably occurs as a direct result of severe parental neglect, abuse, or serious mishandling. So what we are saying is, in the first 5 years of life, if the child suffered severe parental neglect, they suffered abuse, and there was mishandling, serious mishandling, this person will develop reactive attachment disorder, meaning they don't know how to interact socially properly with other people because of the emotional disturbance, because they are so much fearful of other humans who have treated them badly, and these children are looking for with hypervigilance that somebody might come, take them or harm them or not feed them, abuse them. So they are hypervigilant and they will have poor social interaction with peers. This happened when children from orphanages in Romania went to America or other places in Europe, and they were trying to help these children, but these children were quite difficult. They were very fearful and hypervigilant and did not have interactions with their peers, and sometimes they showed aggression either towards self, and sometimes they were suicidal, and misery was quite clearly there because they were treated badly. Some of them were quite undernourished, both emotionally, psychologically, and physical. Food was not there. They were not treated. They were left in cold, damp places. The next one is disinhibited attachment disorder of childhood, a particular pattern of abnormal social functioning that arises during the first 5 years of life and which tends to persist despite marked changes in environmental circumstances. Example, diffuse, non-selectively focused attachment behavior. They were attention-seeking and indiscriminately friendly behavior. Poorly modulated peer interactions. Depending on circumstances, there may also be associated emotional or behavioral disturbances. So in these children, they were having disinhibited attachment disorder. They were attention-seeking. They diffuse, non-selectively focused attachment behavior. And it was poorly modulated peer. They did not know how to deal with the peer groups and will sometimes act in a bizarre way or hit each other when they shouldn't be. These are also called affectionless psychopathy and institutional syndrome when these people were grown up in isolated institutions, orphanages. The other syndrome important here is Rett syndrome, to rule out with the confusion with autism, although it is common only in girls. There is apparently normal parental prenatal and perinatal period. So the birth is normal and there was no problem before birth, and up to about 5 months there is no apparently any problem. So psychomotor development through the first 5 months are normal, and even at head circumference at birth is normal. However, as the 5 months pass and until about 4 years, symptoms tend to appear. The head growth tends to stop, and there is loss of acquired purposeful hand skills between 5 months and 30 months of age that is associated with concurrent communication dysfunction, an impaired social interaction, and appearance of poorly coordinated, unstable gait and or trunk movements. So there is normal birth, but as the child keeps on growing, the noticeable differences in communication, in interaction, in their behavior, movements is getting impaired increasingly. There is severe impairment of expressive and receptive language together with severe psychomotor retardation. So these are progressive in a way. There are stereotyped midline hand movements such as hand wringing or hand washing with an onset at or after the time when purposeful hand movements are lost. Aspergers Syndrome, a disorder characterized by the same type of qualitative abnormalities of reciprocal social interaction that typify autism, together with a restricted, stereotyped, repetitive repertoire of interest and activities as we discussed in autism. It is different from autism primarily in the fact that There is no general delay or retardation in language or in cognitive development. So as a child, milestones are normal, their movements are normal, their cognitive abilities are normal, their language interaction is normal. This disorder is often associated with marked clumsiness, so they become more clumsy, tend to fall things or break things. Motor milestones may be somewhat delayed. They might start walking and taking things slightly later than with their peers. The individual exhibits an unusually intense circumscribed interest or restricted, repetitive, and stereotyped patterns of behavior, interests, and activities. However, less motor mannerisms or preoccupations with part objects or non-functional elements of play materials. There is a strong tendency for the abnormalities to persist into adolescence and adult life. Psychotic episodes occasionally occur in early adult life. If you can't explain it simply, you don't understand it well enough. This is a quote from Albert Einstein. Autistic spectrum disorder is either difficult to identify or they have a number of other comorbid disorders associated with it, like oppositional defiant disorder. There might be specific learning difficulties, like only with reading or with numbers. Adult or attention deficit hyperactivity disorder, anxiety, Tourette syndrome, obsessive compulsive disorder, and attention deficit disorder, depression, auditory processing, sensory integration disorder. Child might be gifted, and developmental coordination disorders. So all these can be either part and parcel of the autism, or sometimes they're getting confused with it, and sometimes they find the comorbid symptoms within the autism. Thank you for watching. If you like this video, please press the like button, share with your friends, and subscribe the channel. I see you again in my other videos.